Recognize Mr. Bilirakis for 5 minutes to discuss his amendment in the nature of a substitute to H.R. 4063. Mr. Bilirakis, you're recognized.
Thank you, Mr. Chairman. I appreciate it. I'm pleased that my bill promoting responsible opioid management and incorporating Scientific Expertise Act, or the Jason Simkowski Act, the Promise Act, was included in today's market. I appreciate it so much. The amendment I'm offering today seeks to strike the right balance to combat the epidemic of overprescribing of opioids while not restricting access to patients when appropriate for their treatment plan. An advisory committee will be comprised no later than 120 days after the date of enactment of this legislation. This committee will conduct a thorough review of current DoD VA clinical guidelines available to date and examine whether such guidelines should include the recommendations outlined in this bill. After 1 year of enactment, the committee, in consultation with the VA DoD Management of Opioid Therapy for Chronic Pain Working Group, will update recommendations to such guidelines if appropriate and necessary. Veterans are a high-risk population for prescription misuse and abuse, and unfortunately a significant risk of depression and suicide. One veteran patient, Marine Corporal Jason Simkowski, died due to mixed drug toxicity during his time in an outpatient center at the Tomah, Wisconsin VA Medical Center. This legislation will help prevent such tragedies, and I've spoken to the family, and they're supportive of this bill. Statistics have shown more than half of VA male primary care patients report chronic pain when returning home from their service to this great nation. Additionally, the female veteran population is experiencing increases in chronic pain, and that statistic will likely continue to increase considering their assimilation into frontline military operations. Currently, VA treatment for chronic pain is largely the prescription of opioids with the consideration of a patient's personal history, without the consideration of a patient's personal history or preferences. Unfortunately, there's a lack of data on veteran opioid use. There are also significant inefficiencies in the VA identifying abuse of opioids and with patient follow-up to determine effectiveness of these drugs on a case-by-case basis. The tragic death of Marine Corporal Simkowski highlights just one example of these failures. The Promise Act is the congressional action needed to rectify these problems. The bill requires the VA and DoD to update the clinical practice guidelines for management of opioid therapy for chronic pain, as I said. VA opioid prescribers would also be required to enhance opioid education and training to ensure veterans are receiving the true care they have earned and deserve. The Promise Act also acknowledges that VA patient services do not stop at the initial consultation. It requires the VA to maintain a real-time tracking of data on opioid use of veterans. This initiative will help the VA prevent over-medication and identify misuse or overuse of medication. The bill ensures that our veterans have the same treatment options as the non-VA healthcare community. While opioid prescriptions work to curb chronic pain in many veterans, it should not be the sole way veterans are treated, especially considering the risks. Therefore, it seemed only natural to include language from another one of my priorities, the COVER Act, within this bill before us today. Title III of this bill opens alternative treatment options to our veterans, such as outdoor sports therapy, accelerated resolution therapy, medication and service dog therapies, and more. I'm almost finished, Mr. Chairman. The VA would conduct a patient-centered survey to analyze the potential benefits of incorporating these therapies into veteran health treatments. The Promise Act prioritizes patient-centered health care with improvements to patient advocacy through community meetings at VA facilities and improvements to the VA outreach initiatives. Can I have additional 10 seconds? You mind?
Gentleman is recognized for another 1 minute.
In closing, the Promise Act gives us more choice. Veterans should have a choice, not one size fits all. More choice to veteran patients seeking care at VA facilities. Reduces the chances for opioid misuse and abuse, and engages the veteran community in further improving VA health care. With favorable passage of this bill, of course the A&S first, we uphold our sacred vow and promise to our nation's veterans. I urge my colleagues to support my amendment and the underlying bill, and I thank you so very much, and I thank all the members for their support of this great bill.
Thank you very much, Mr. Bilirakis. I will be supporting his amendment and would ask, is there any other discussion on the amendment in the nature of the substitute?